Susan Levy, Program Manager with Native Health. Can you tell us a little bit about Native Health?
Native Health is a primary medical, dental, behavioral health, and WIC program for urban Native Americans. We have 2 clinics, one on Central that targets urban Native Americans, and our newest clinic on Dunlap, which is open for anybody. We provide walk-in medical at both locations and free transportation. We see about 12,000 people a year and about 68,000 visits. The mission statement is of the Native American Community Health Center, which is also Native Health, is to continually strive to improve the lives of Native American families in the greater Phoenix area by providing unique, high-quality, culturally competent, health-related services that enhance the well-being of the whole person and the Native American community. And actually every grant that we write is aligned or has to fit the mission, or we don't write it. So every program in the agency fits that.
Program in particular is funded by SAMHSA. I'm not sure if you're aware of them, but it's the Substance Abuse Mental Health Study Association, something of that sort. I can't remember exactly because we just call it SAMHSA all the time. So we're funded by them, and it's to use a specific treatment model. We have an agreement for 3 years. 3 years. We serve Native American teens from any tribe that are ages 13 to 18, and depending on their cognitive level, sometimes we can go a little above 18 if, you know, maybe they're emotionally not quite that age, and we still work with them. And we do work with teens. Most of our teens are from group homes. They've been placed in group homes from their tribal community. And then we do a lot of just urban natives that have moved here from their tribal community. We provide 8 to 12 individual sessions. We use a treatment model that's called the Adolescent Community Reinforcement Approach, and that's what our grant funds us to use. And that's 8 to 12 individual sessions with them then moving on to a different level of care, which is advocacy and case management, providing them with assistance for a couple things, reminding them the skills that they learned with their therapist, and also any help they may need fulfilling probation requirements, school requirements, connecting with their family, whatever it may be, and that goes on for 12 weeks. And then every 3 months, from the day we meet them, 3 months, 6 months, and 12 months, we do an assessment with them to identify where they're at in their recovery, and you know, if they're still using. And then also, because we're in a research project right now, and that's to collect data to identify how well the treatment model is working in this population. Right. The program is accessed simply by, you know, we get referrals from all over the place. We're connected with, like the Phoenix Indian Medical Center. We're connected with Phoenix Unified High School District. Probably all of the probation facilities from Maricopa, and then as well as we're connected with a lot of group homes. Mm-hmm. And was it the qualifications you're asking?
Right, the eligibility.
The eligibilities, they just have to be Native American between the age of 13 and 18, and experiencing either substance abuse or risky behavior. Maybe they haven't started using yet, but they're showing the signs that may lead to use, such as they're starting to ditch school, not following rules, their grades are slipping, stuff like that. So we use our treatment model to maybe help deter them from what might be the next step.
Right. And do they need to provide their tribal ID card?
Yes.
Okay.
So we ask for a certification of Indian blood. We ask for a copy of a picture ID. Can be a school ID or a state issued ID. And then also a copy of either Social Security card or the birth certificate.
Okay.
Delivered individually. So just the the client and the counselor can be in home, sometimes in school, in office, and then from that point on, it's case management, all out in the field for whatever needs they may have. They are evaluated two different ways. One is the Center for Substance Abuse Treatment. We do interviews with our clients throughout their process to identify how their use has changed, how their lifestyle has changed, and then that's how the government kind of gets their info on how well the money that they're funding for their program is working. And then there's also the research portion. We have a facility that's called Chestnut, and it's a research agency. And we do assessments. We use an assessment called the Global Appraisal of Individual Needs, which we just shorten to GAIN so we don't trip over our lips. And we do that assessment every 3, 6, and 12 months. The first assessment's about 3 hours, so it's really in-depth, detailed. We cover physical health, mental health, risk behaviors, emotional health. We go through all the different areas of the teen's life to see what they may need assistance with. Then when we meet them 3 months later, 6 months, 12 months, we do a modified version of that first GAIN and kind of cover the same areas, just a little shorter, and that helps us track how well the outcome is. And then we have our research agency, Chestnut, that collaborates all of our data and kind of tells us how to do it. I think one of the biggest ways would be for our funding to allow for transportation. That is our biggest problem for getting kids and services, because our services are free. But getting here is not always the easiest thing for our clients. We do go to the home, but the more we go to the home, the less clients we can see due to travel time and all of that. So that would be really helpful. It would be helpful to be self-sustaining, meaning because we're grant funded, when the grant ends, it goes away. The treatment goes away. So it could be improved by finding a way to continue services, can keep everything alive, which would allow us to, continue to serve the community. So I would say those are our biggest things.